Hi CAM followers, it's Amy here, and I have got the fabulous Dr. Ed Hall with us, and he's going to talk to us about gastrointestinal disease when you've got that concurrently with a dog that's got arthritis. So we're really, really grateful to have you here tonight, Ed, so thank you so much for joining us. So before we get started, because CAM is volunteer-led and self-funded, I do have to just have a quick punt about our owner course that Hannah spent a long time writing. So if you are interested, do head over to our cameducation.co.uk website. It's a modular course and it goes through every single aspect of canine arthritis management, right from the basics all the way through to some far more advanced things, and it can be really, really helpful and a huge insight if you have got a dog that is suffering from arthritis. It can be really, really helpful to show even just the small things that you can change in the household to help them be at their best and help their pain be as well controlled as you can manage it. So I'll just let that play one more time and then we'll get down to the exciting stuff. So I just want to properly introduce Dr. Ed Hall tonight. I have very fond memories of my lectures at university, which Ed led the whole gastroenterology and GI sort of unit when I was in my fourth and final year, and lots of fun learning how to do endoscopies and all sorts of stories that I hold dear to my heart of my time in University of Bristol. So it is an absolute pleasure to be hosting tonight's live with Dr. Ed Hall himself. So I will pass over to Ed and he can introduce himself, and he's got a really helpful presentation tonight so that we can have a look at some of these aspects of gastrointestinal disease.
Okay, thank you very much, Amy, and good evening, everybody who's out there. It's always weird talking to a virtual audience and you don't know what you're doing. So if you're doing your emails while you're listening, that's okay, because that's what I do on Zoom calls as well. I'm delighted to have been invited to speak for CAM. It's a very important organization because arthritis is a major problem in older dogs. My own old dog certainly suffered in his final years, so it's important. And as Amy said, I've got a PowerPoint presentation to start with, and then I'm going to be more than happy to try and answer questions. So I'm going to try and share my screen and hopefully the technology will work.
Yes. Great, I'll just add that into the stream. There we go.
So hopefully everyone can see that. So as Amy said, I was at Langford. I actually retired this year. I'm that old that I needed to retire. You know you're getting old when you sigh when you sit down and you groan as you stand up. And those older ones in the audience will recognize those two things that happen as you age. So I'm now an Emeritus Professor of Small Animal Medicine, and I'm recognised by the Royal College as a specialist in gastroenterology. And I was intrigued by being asked to speak about GI disease and arthritis because it's not something that I particularly have focused on in my career and my research. Before we go any further, I need to declare any conflicts of interest. So these are some of the organizations and companies that have funded my research throughout my career. And the only one that's probably of relevance is this one now highlighted in red, Pfizer as it was, so it is as it is now. I was what they call a key opinion leader. They had a meeting of key opinion leaders to discuss a new non-steroidal that they were about to market. And the best thing about that whole role was they took us all to the Isle of Capri to have those discussions.
Amazing.
Yeah,
I'm quite jealous of that.
But they probably weren't thrilled when I told them not to market their non-steroidal, but they did anyway, and it's fine. So yes, I practice I was practicing referral medicine until I retired this year, but mainly on GI cases. So I'm not a specialist on joint disease. I'm not an orthopedic surgeon. And in my career, in a referral center, I rarely prescribed arthritis medication. And clearly, first opinion vets have got much more experience of using medication for arthritis. But I have got some views on the use of these medications in GI disease. So I'll start with a bold statement, probably not one that people want to hear, is that non-steroidals, which are the mainstay of managing osteoarthritis in dogs, are contraindicated in both acute gastroenteritis and chronic GI inflammatory diseases. In acute gastroenteritis in particular, the problem is that they can get rapidly absorbed. And if the animal's got severe diarrhea and is dehydrated, then you can get kidney damage with that. But we know that, unfortunately, non-steroidals can damage the lining of the gut. And therefore, if you've got a chronic inflammatory disease in the gut, giving a non-steroidal, in theory, could make it worse. Are there any other correlations between GI disease and arthritis? Well, certainly primary GI disease can trigger what's called immune-mediated polyarthritis, where multiple joints are affected by an quite intense inflammatory reaction. And that's because antibody antigen complexes, immune complexes, get filtered out into the joint space and cause that inflammatory reaction. But if you treat the GI disease, that polyarthritis should resolve. The other interesting thing, and preparing for this talk, this is something I came across more and more, is that the GI disease may contribute to the development or progression of osteoarthritis. And that's thought to be largely due to the fact that we have intestinal dysbiosis when we have GI disease. And by dysbiosis, we mean an unhealthy change in the microbes that normally live in the gut. So this is something that's quite current. It's certainly being explored in human arthritis. There's a review paper here. If you're really interested, it's open access, showing that dysbiosis can contribute to the development of osteoarthritis, and a change in what they call the microbiome, that's the whole population of bugs in the gut. By changing that, it can reduce the progression of osteoarthritis. And that may be how some of the protective nutraceuticals you may be using to manage osteoarthritis may actually be working. It's not just working on the cartilage in the joint, it's actually altering the gut microbiome. And it's now being targeted as something, as a way of managing osteoarthritis, just another weapon in the war on this horrible condition. So do we know about changes in the microbiome in dogs with the osteoarthritis? And there's this one paper that came out late last year from Italy. They looked at the microbiome. They did sort of genetic analysis of the bacteria in the feces in healthy dogs and dogs that had osteoarthritis due to either hip or elbow dysplasia. And they showed quite clear differences in the microbiome between those two groups. So clearly dogs with osteoarthritis do have a different microbiome. However, what they didn't really clarify was this because they had osteoarthritis, was their osteoarthritis bad because they're actually obese? And we know that obesity could also modify the microbiome. And in fact, when they studied them, a lot of them had been on non-steroidals. They took them off them for 1 month to do the study, but previous use of a non-steroidal might have affected the microbiome. So we don't know for definite that there are changes in the microbiome in arthritis, but it seems quite likely based on what we know in people. So that's a possible link between GI disease and arthritis, but probably the major issue for most of you, if you've got a dog with arthritis, is the interaction between the treatments for osteoarthritis and the GI tract. Now, we do occasionally use them for specific GI conditions. So colorectal carcinoma, which fortunately is quite a rare condition in dogs compared with people, it's been shown that some non-steroidals, piroxicam, meloxicam, can be sort of palliative and slow the progression of the disease. Surgery is potentially curative, but not always technically possible. So palliation may be necessary. And this is because the non-steroidals act on an enzyme in the tumor cells and sort of stop their growth. And it's the reason why medics sometimes recommend that you take an aspirin a day to try and prevent the development of chronic cancer. Mm. There are also some treatments that we use in GI disease that may benefit osteoarthritis, and similarly things that we use to treat osteoarthritis or manage it that may benefit an animal with GI disease. And one of the main treatments I think is useful for both is dietary modification. A lot of chronic GI disease we can manage very well by modifying the diet without having to resort to drugs. And by doing that, we almost certainly are altering the microbiome, so that may have a knock-on effect on the osteoarthritis. But also, if you're careful with the diet, if the dog is overweight, then you can get it to lose weight, and that's going to be beneficial for its arthritis. We unfortunately have to use steroids sometimes in chronic inflammatory GI disease. They are anti-inflammatory, they are immunosuppressive, and they sometimes are the only thing that can work, or there are more potent ones that we sometimes have to rely on as well. So they potentially are helpful in an animal with osteoarthritis. They will certainly seem to be more comfortable, more mobile. However, there are side effects of steroids which are not so good for an animal with arthritis. The steroids can make them hungry, and if you're not strict, they're going to eat more and they're going to gain weight, which is clearly not beneficial. And also long term, they can weaken ligaments and be harmful to joint cartilage, so actually make the condition worse. So I wouldn't use steroids to manage osteoarthritis unless I'd run out of every other alternative. What is beneficial for both GI disease and arthritis is some degree of exercise, obviously not excessive exercise, and weight loss. And we know that by losing weight, the pressure on the joints is significantly reduced and the animal is a lot more comfortable. But this idea that exercise can help the arthritis and the GI tract is an interesting one. There aren't many studies of this in GI disease. In fact, this is the only one that I've come across. And this was a study, it was out of Taiwan, and they were treating dogs with what they call inflammatory bowel disease with a reasonable dose of prednisolone, which is a steroid. So they gave that at a high dose for 14 days, and then over the next 10 weeks, they tapered the dose. And at the time they started to taper the dose, they added in some complementary exercise. So they were measured the effect of these interventions by what's called the Canine Inflammatory Bowel Disease Activity Index. This is a numerical score made up of a number of clinical features, going from 0, which is perfect stool, up to 13, which is the worst diarrhea you can actually imagine. And they had a control group, and their average score was 9.2. And after the treatment with no exercise, it didn't really change. And maybe they didn't give enough steroids, because that's not a great response. But what was interesting with the exercise group, the starting score was a little bit lower, 8.8, but it dropped drastically to 2.4. So they showed that this exercise program really seemed to improve the chronic diarrhea. Mm-hmm. Now, as you're well aware, too much exercise is not going to be good if you've got arthritis, but some degree of exercise, mild exercise, is recommended. And what was really interesting in this study was the level of exercise that these dogs underwent. So it was a very low intensity exercise. And I need to point out, this was a study from Taiwan where mainly they have little toy breed lap dogs whose feet never actually touch the ground. So any exercise, any walking is very unusual for these dogs. They're carried everywhere in people's handbags or sit in their laps. And they had two types of exercise. One was aerobic training, where they were forced to trot for 10 to 60 seconds and do that 3 to 5 times in each set. So that's each day. And I think even I could trot for 60 seconds. So it's not excessive exercise. And then resistance training was even more bizarre. They got them to stand on a slope for up to a minute. And they repeated that 5 times. So it's not like they were climbing hills or anything like that. They were just stopping them being lap dogs and getting them to do a tiny bit of exercise. And the results were quite remarkable. So, as I said, some treatments for osteoarthritis we use for colorectal carcinoma. They may be of benefit. They are contraindicated in most GI disease. And the other problem we have is some of these treatments for osteoarthritis, the drug treatments, can cause GI signs as a side effect. And that's obviously what worries a lot of people. But the maxim is that there's no drug that's effective and is 100% safe. If something is 100% safe, it doesn't do anything. It's not going to help an animal with osteoarthritis. And this maxim is especially true for non-steroidals. They are very effective, they are very helpful, but they're not completely safe. So what people most commonly recognize is that non-steroidals will cause gastric disease, so-called gastropathy. You can get gastric ulcers, gastric bleeding, and vomiting. But they also can affect the intestine as well, can cause bleeding, diarrhea, and potentially even stricture formation. So I just want to talk about the enteropathy first, and then we'll focus much more on the gastric disease, because that's much more of a problem in our patients, in dogs. So this enteropathy is seen in people who are on chronic non-steroidals, and they get small intestinal ulcers, bleeding, and they can develop strictures causing partial obstructions. And what's interesting is in people, this is more likely to happen if they're taking an acid blocker, something like omeprazole. Losec would be the trade name. And this is often given to try and prevent the gastric ulceration, but it actually can make the enteropathy worse. But the other interesting thing is that the bacteria in the gut, the microbiome, has an effect on whether people get this enteropathy. So there's potentially a role for dietary modification to alter the microbiome, and potentially a role for probiotics to modulate the microbiome. So this is kind of what you get. I hope you're not too squeamish. This is an ulcer in the small intestine of a person on a non-steroidal called diclofenac. It's not one we use typically in dogs. And this is a surgically removed piece of intestine. It's been fixed, which is why it's a funny color. And here you can see a number of strictures that have developed in this piece of small intestine that had to be removed. And what's interesting is the non-steroidal potentially can damage the gut epithelium, the intestinal epithelium, but it's reabsorbed and then re-excreted by the liver with bile, and that makes it more toxic. And then it's the so-called gram-negative bacteria, things like E. coli in the gut, that can enhance the epithelial damage. And that's where modifying the microbiome may be beneficial. So what about the enteropathy in dogs? It has been seen, the ulceration, using what's called a video capsule endoscope. This is a little capsule that's got a light and a camera in it, and it takes pictures as it passes down the GI tract. So yes, small intestinal ulceration can occur, and I'm sure some of you have had dogs that develop diarrhea when they're given a non-steroidal. What hasn't been reported, fortunately, is the development of strictures that are seen in people occasionally. More important in dogs is the gastropathy causing gastric ulcers. And non-steroidal anti-inflammatory drugs are the #1 cause of gastric ulceration in dogs. And they do that by inhibiting the synthesis of prostaglandin, particularly prostaglandin E. And I'll come on to what its role is shortly. Steroids in high doses can also cause ulcers in the stomach, but they also delay healing. And therefore, if you've got an animal on non-steroidals that develops a small ulcer and you also give it steroids, then that ulcer can get worse because it won't heal. So we should never be giving dogs non-steroidals and steroids at the same time. So non-steroidals damage what's called the gastric mucosal barrier. That allows gastric acid to diffuse back into the wall of the stomach. That causes release of histamine in some of the cells in the stomach wall, which causes changes in capillary permeability. So the blood vessels become leaky, which leads to inflammation, which leads to ulcers, which leads to the clinical signs of vomiting, bleeding, and pain. So what is this gastric mucosal barrier that the non-steroidals are damaging? Well, it's a complex structure, and it's really important because the stomach lining is bathed in gastric acid, hydrochloric acid, and it's fascinating that it doesn't dissolve itself. If you put a piece of bone into the stomach, the gastric acid will eventually dissolve it. So why doesn't the stomach dissolve? Well, yes, you've got gastric acid in the lumen, but the gastric epithelial cells are secreting bicarbonate into a layer of mucus to help neutralize any acid that might be diffusing back into the gastric wall. Then we've got the epithelium, and there are tight junctions between the cells that prevent acid getting through. There's sort of an electrical charge across the epithelium that repels the acid. And really importantly, we've got prostaglandins being produced that support those functions of the epithelial cells. And then those epithelial cells are fairly unique in that if there is a small ulcer that develops, they can actually migrate and cover that ulcer within a short period of time. So you don't just get healing by the normal healing you get if you had a skin wound. They actually cover the hole up really quickly. And then the prostaglandins are also important in improving the blood flow to the lining of the stomach to neutralize any acid that does get across the barrier. So these prostaglandins, particularly prostaglandin E, support the integrity of the mucosal barrier. They increase mucus secretion, they decrease acid secretion, they stabilize those histamine-containing cells, and they improve gastric blood flow. So they're really important for the health of the gastric mucosal barrier. And non-steroidals inhibit the production of prostaglandins. And so we know because of that, they can cause ulceration, and they probably cause it more frequently than you imagine. Excuse me. So this is the stomach of a 16-week-old puppy who was presented because it had severe anemia and was vomiting up blood and passing blood in its stool. And what we can see on the surface of the stomach are multiple small ulcers that are all bleeding. And this is a classic appearance for gastropathy caused by non-steroidals. But this is a 16-week-old puppy. Why would it be on non-steroidals? And certainly the vet that referred it in for endoscopy hadn't prescribed them. And it took a while to get the information from the owner, but she had been giving it 1 aspirin a day ever since she got it as a puppy at 5 weeks of age. And that's what aspirin can do to your stomach. And in people, about half the people who just take 1 aspirin will have similar small gastric bleeds, probably not as many as this poor dog, but a few small bleeds, but they're not symptomatic. So taking aspirin is not likely to cause you any harm unless you take it chronically or you overdose. So do non-steroidals cause lesions when they're given chronically to dogs? And this is probably the most recent study. There are lots of other studies out there, but this is probably the most recent and the best one. But it was a small study. It was only 12 dogs who'd been on non-steroidals for 6 months, a range of different non-steroidals, carprofen, meloxicam, furocoxib. I'll come back to what those are in a bit. And they used video capsule endoscopy to look for both gastric and intestinal lesions. And 10 out of the 12 dogs did have gastrointestinal erosions found by endoscopy. And they were seen with all of the 3 non-steroidals in at least 1 dog. So it's not as if one non-steroidal is worse than another in this study. Only 3 of the control dogs had gastric erosions, and that can develop for other reasons. It can develop spontaneously, or they ate something that was abrasive. But what was important is that none of these dogs had clinical signs. So probably if your dog is on chronic non-steroidals, it may have some small gastric erosions. They're not clinically significant, and you shouldn't be worried too much. But in some dogs, and we don't know why, there can be serious side effects. And certainly in people, they think there's probably some genetic basis to this. We just don't know in dogs. We can get deep gastric ulcers, which are going to bleed quite a lot. So you can see here on the right. The worst case scenario is that ulcer erodes through a small artery in the wall of the stomach, and you get this arterial bleed. And I've seen one dog bleed to death through this, which is not good, but it's very unusual. And then, unfortunately, we can also get perforation. So here's a dog at surgery. There's a stomach with an enormous hole in it. And this is a Labrador that had been on meloxicam for over a year and had just started vomiting blood. And we probably see more of these with meloxicam than any other non-steroidal, but that's because meloxicam is the most commonly prescribed non-steroidal. It doesn't mean it's necessarily less safe than the other ones. We also see it even more frequently when someone has given non-steroidals and steroids together. So non-steroidals work by inhibiting the production of prostaglandins. They inhibit an enzyme called cyclooxygenase, or COX for short. And the beneficial anti-inflammatory effects of non-steroidals are because they inhibit a so-called a version of COX called COX-2 that is involved in making the prostaglandins that are involved in inflammation. So by damping down COX-2, you reduce inflammation. That's why they're beneficial in lots of inflammatory conditions, including arthritis. But they can also damage the COX-1 enzyme that's there in the gastric mucosa that's producing the normal cytoprotective prostaglandin E. And they can also directly be toxic to gastric epithelial cells. So I can probably summarize that best in this diagram. On the left, you've got the normal mucus and bicarbonate and the mucosal blood supply, but the prostaglandins can damage the epithelium directly. They also inhibit prostaglandin production. They inhibit, or because they're blocking prostaglandins, they stop bicarbonate production. They stop mucus production as well, and you're likely to potentially get an ulcer. So the safety of non-steroidals depends on their sort of relative specificity for the COX-2 versus the COX-1. So aspirin has no selectivity. It will inhibit both, and that's why it's not a great non-steroidal to use chronically. Meloxicam is what they call COX selective. It inhibits COX-2 more than COX-1, but in GI disease, I wouldn't want to use meloxicam. The so-called COXIBs are the sort of next generation of non-steroidals. They're much more specific to COX-2, so they particularly inhibit the inflammatory, the production of inflammatory mediators. And they cause much less inhibition of COX-1, but they still do cause some inhibition, and they can still cause gastric ulceration. So the non-selective ones, aspirin, ibuprofen, and naproxen, are used in people. And I need to say is never, never, never use ibuprofen in dogs. It's got a very prolonged half-life, and so you're very easy to overdose it and cause a perforating gastric ulcer. Meloxicam, and there's a whole range of licensed products in the UK, is selective for inhibiting COX-2. And then we have the COXIBs, which are probably the ones used more frequently now, that inhibit the COX-2 enzyme preferentially. And so there's, again, a range of them. I don't believe Deramax Deracoxib is available in the UK, but it is available in North America. So lots of dogs have non-steroidals with no side effects, and that's great because you can manage their arthritis much better. But if they do, what can you do? Well, sometimes you get a different response with a different non-steroidal. So talk to your vet if you're an owner of a dog that they've given you a non-steroidal and it caused diarrhea or it made it vomit. Try a different non-steroidal. It may be okay. Avoid steroids at the same time. Give acid blockers potentially to stop gastric ulcer formation, but most dogs that's not going to be necessary. In those where you're certain you're going to get some problem because you've had an ulcer in the past, you can give a synthetic prostaglandin alongside it, misoprostol or Cytotec, but it's quite expensive, and it's really only for those dogs who be so, their quality of life will be so poor without their non-steroidal, but they can't tolerate the non-steroidal on its own. You can reduce the ulceration with misoprostol. Interestingly, ulcers tend to develop in diets that are high in fiber. So reducing the amount of fiber in the diet may be beneficial. And whether that's just a physical abrasion effect, nobody really knows. But the other thing to try are other drugs that aren't non-steroidals. So nutraceuticals, and I suspect people will be asking questions about those, the so-called chondroprotective things like glucosamine and omega fatty acids. Steroids, again, I said I probably wouldn't use those unless I was desperate. Carprofen, potentially, it's a non-steroidal, but it may not cause ulceration, although that latest study did suggest it did. Paracetamol is quite a good analgesic. It's safe in dogs. It's not safe in cats. Never use it in your cat. There's Galiprant, Grapiprant is the drug. And the new one on the market is a monoclonal antibody, VetMB. I can never say those names. Librela, you'll know it as. So carprofen is a non-steroidal, but it probably works by a different mechanism, not by COX inhibition. And in general, it doesn't cause GI ulceration, although that last study I showed you found some small erosions. But it's not always popular, particularly in North America, because it was linked with possible liver damage. But that was probably the dogs that were studied already had some underlying liver disease. So I probably wouldn't use it if we've got liver disease. Galiprant has an effect on the prostaglandin pathway, but it doesn't inhibit the whole thing. It binds PGE2 and prevents the activation. It blocks the activation of a particular prostaglandin receptor. It can cause some GI side effects. 1 in 10 dogs may vomit on it. Up to 1 in 10, up to 10 in 100 may have some soft stool or even diarrhea, and very rarely, less than 1 in 10,000 has gastric ulceration and vomiting blood or hemorrhagic diarrhea. And then finally, Librela. This is the new one on the market. It's a monoclonal antibody against this nerve growth factor. I'm not aware of any GI side effects. There's no data on its safety in concurrent GI disease. They haven't done those studies, but I think the biggest problem at the moment is the demand has outstripped the supply. So it's not available, my understanding is not available for new cases at the moment, but animals that have started it are still being supplied with it. And the reports that I've seen are quite positive, but be interesting to hear people's experiences. So that's the end of the presentation. I went on longer than I should have done. I'm happy to answer any questions, but also if you've got questions, go to the CAM website, speak to your vet if you're an owner of a dog to discuss the best way to manage the arthritis. Non-steroidals is really important, but they're not the only thing that you want to use.
Thank you so much. That was such an informative presentation and really covered sort of all of the aspects that so many people on CAM are asking and wanting to know more information about. Please, if you do have any questions for Ed, now is your opportunity to put them in the comments, and we will Ed will try and answer them as best as he can. Do keep in mind that Ed's area of expertise is sort of GI disease, and so some of the more sort of rheumatology based questions we can take those away and certainly come back with answers. You may well be happy to answer them anyway, but
well, I'll go down the list, and there's one fairly on from Ray about her dog that's got carpal hyperflexion problem. I could ask, it's probably a Sheltie or a collie. I don't think there is a good medical treatment. Usually it requires surgery, so-called arthrodesis, where the joints are fused, and that can be very successful. Cool.
Okay, Hayden's written, can you elaborate on the use of probiotics?
Yeah, probiotics are kind of very fashionable. The problem we have with them is there really aren't that many good controlled studies, and what nobody really knows is what's the best probiotic or combination of organisms, what dose and what frequency. I mean, the live bacteria you find in your yogurt are not going to do anything. There are a number of veterinary licensed or veterinary products which contain a single organism. There are human ones which actually have a combination, and they're probably more likely to be effective. But what you need to get your head around is that most probiotics, the most you're going to have is about 10 to the 9 bacteria in each dose, which is 1 billion in UK, European numbers. I think it's more than that in American billions are 10 times smaller. So it's 1 billion bugs. In 1 gram of fecal material from a dog, you've got something like 1,000 billion bugs. So how is that probiotic actually going to do anything? And that's why another fashionable treatment is what's called fecal microbial transplant, where you take feces from a healthy animal and infuse it into the gut of a diseased animal. I don't think anyone's tried that in arthritis. They're trying it in people, lots of diseases, specific GI infections like Clostridium difficile infection, but they're trying it in inflammatory bowel disease in people. They're even tried it in schizophrenia and obese people. Although my understanding is that the FDA in North America have banned it now because 1 person died because the donor was carrying a pretty nasty bug that got passed on to the recipient. Yeah, so I'm not a great fan of fecal microbial transplant. It doesn't sound very nice either, but it's kind of trendy. Going back to the probiotics, I suspect every probiotic will work in a certain individual animal for a certain individual condition, but we just don't know what it is. And we probably need designer probiotics. And that's now that we can analyze the microbiome, that potentially is going to be the way we go. So you'll send your poo sample off from your dog, you'll get an analysis back, and they'll tell you which bugs are missing and what you need to give as a probiotic. There are some companies out there doing it at the moment. I wouldn't recommend them because nobody knows what really works because they haven't published anything. So you could spend a lot of money doing it. I know there's a company in California that will design a probiotic for you, but they have no evidence that their design works. Okay, so Tylenol that's paracetamol, isn't it?
Yeah.
So you can use Tylenol. Cassie was asking, don't use ibuprofen. Tylenol, and I think Advil. Is that aspirin? I don't know.
Pretty sure that is the US version of aspirin, but
yeah. So you can use Tylenol. I think the dose is 10 milligrams per kilogram, but don't quote me. That's
what I usually prescribe, is 10 mg per kg.
Yeah, in the UK there is a licensed product called Pardale that we're supposed to use because it also contains codeine, which has a little bit of analgesic effect as well, although most of it's not absorbed. But it's a lot more expensive than paracetamol from your pharmacy.
I've just Googled Advil, and I think it actually might be.
Is it paracetamol?
I think it actually might be the US version of ibuprofen, so that's a definite no.
Okay. Yeah, definitely not. Okay. Duralactin, I don't know what that is.
No, I Googled it because I hadn't heard of it either. It's a joint plus soft chew. What's it got in it? It's got a dried milk protein in it, 1,000 milligrams of microlactin.
Okay. I mean, again, that may affect the microbiome and that may have some benefit. Preparing for this talk made me realize there are lots of research studies I'd like to be doing, but I'm retired now, so somebody else will have to do them. So someone was asking about gut transplants. I presume, Laura, you meant fecal transplants. Replacing the whole gut has been done in people, but it's technically it's quite difficult. But the biggest problem is that the gut is actually the largest immune organ in the body, and so when you take the gut from a donor and put it into the recipient, the gut rejects the body rather than the body rejecting the gut. So it can cause significant problems. I was involved in some research where they were doing it in pigs, and it can be successful, but it's not something done routinely. So Haley was asking about paracetamol. Yes, Tylenol is the same. Laura did mean fecal transplants. So the difficulty with fecal transplants, I think, is we don't know what a good donor is. We don't really know how to screen the donor either. In human medicine in the UK, there's actually a biobank of fecal material there that can be used. They spend £5,000 screening that donor for every known infectious disease.
Wow.
And people doing it in veterinary medicine usually just do a stool culture and look for Salmonella and Campylobacter and stop at that point. And so we really don't know what we're transplanting. In North America, as I said, the FDA stopped it. I don't know whether they've allowed it again because someone had a really nasty E. coli. It was the donor. But there have been studies that show that some donors are more successful than others. What they call super donors, or the gold ones. So there's one study where they did transplants in about 10 people. 9 of them did. The recipients did really well, and 1 didn't. And when they look back, the 9 actually had a transplant from the same donor. So he was the man with the golden poo. And so they went back to him to get more poo. And unfortunately, he'd had an infection and been given antibiotics. And his poo no longer worked because the antibiotics had caused dysbiosis. So if you can find an ideal donor, great. But how do we identify them? I don't know. Is it possible to get a handout of these slides? I mean, I'm happy to create a PDF if that can be put up. Is that suitable?
Yeah, that's something that we can do, and we can share it if you're happy to do that.
Sure,
Thank
sure.
you. That's really grateful for that.
Yep. So someone saying that their dog's had Librela. That's good. What have you used it, Amy?
Librela? I have used. I'm actually using it. I used it in my own dog, so as soon as it became available, because he is sensitive to non-steroidal anti-inflammatories. I've tried Metacam and Carprofen and Onsior as well, and he gets diarrhea very frequently. So I ended up, what we did was we sort of gave him a smaller dose of non-steroidal anti-inflammatory, and not necessarily every day, and we would use paracetamol on the days, other days, so that we could try and give him the anti-inflammatory, but not quite so much that would tip his gut over the edge. So I moved him onto Librela as soon as I could, and I'm sort of able now to sort of dose him with Metacam if he does particularly too much. So, for example, we've got a young dog in the family, and if he does too much with them, then I will give him a Metacam dose. But I have been able to bring him off Metacam, which has been really quite amazing for him, and it has sort of meant that he is having far less diarrhea. So I've had a positive experience with my own dog, but I know that some of my other patients that have had it, owners haven't noticed a difference. I guess it depends how much of their pain is neurological and how much of it is other things, or like a physiological change.
I mean, obviously in a lot of dogs it seems to control the pain. Do we know whether it slows the progression of the disease? I'm not certain we do.
Yeah, no, I don't know any data about it slowing the progression of the disease. My understanding was that it just basically stopped that pain being transmitted to the brain. And
that's certainly obviously the most important thing about arthritis is stopping the pain. But if it doesn't improve long-term mobility, it may not be the ultimate answer. But I mean, it came out after I retired, so I have no experience of it whatsoever. And it sounds almost too good to be true. And it's a bit like some of the other monoclonal antibody treatments that are there for atopy, things like Apoquel. Initially, people thought they were wonderful, and then you start to realize that no drug is effective and safe. There are always some side effects.
Yeah, absolutely. And I mean, my dog is now 10, so dog life span is, he's probably going to live to about 13 or 14, maybe 15 if we're lucky. So I guess as we use it for longer, we're going to see things, and there'll be more studies done on it, I guess, and we'll get to know more and more information. But it is one of those things, isn't it?
And I'm looking at the last question from Laura, and it's the chicken and egg question. How do you know if arthritis causes changes in the gut microbiome, or if changes in the microbiome increase the risk of arthritis? And the answer is, I can't tell you. I think there's some evidence that dysbiosis will make arthritis worse. I don't think it actually evidence that it causes it in people anyway. But it's also like that with intestinal inflammation. When you've got GI disease, you get dysbiosis as an effect, but it also, dysbiosis can cause diarrhea, and you never know which comes first. But by trying to normalize the microbiome with probiotics, fecal transplants, or dietary modification would be my number one choice to do that, then the microbiome does seem to improve again. But everything has an effect on the microbiome. I mean, the microbiome changes between night and day over a 24-hour period. It's not static. And then if an animal has antibiotics, we know that definitely affects the microbiome. And although it sort of slowly drifts back to how it was before, it never quite returns to what it was initially. And so I think we're obviously there's pressure on us not to use antibiotics too frequently, but I think there's also good reason for the long-term health of the animal not to use antibiotics unless they're needed as a life-saving thing. So just like doctors won't give you antibiotics if you've got a cough, and I'll apologize for coughing. It's not COVID. It's old age causing me to cough. Using antibiotics just in case is the wrong thing to do.
Yeah. And when you talk about dietary modification, what is it that you recommend that can give sort of owners and their pets the best chance of a healthy microbiome?
Well, with GI disease, what we tend to do is start them on a hydrolyzed diet, which is a pretty specialized diet. The proteins are all broken down into small molecules. Because of that, it's expensive, and you can only get it through your vet usually. But we're not in it just to make money. It works in a lot of cases with chronic diarrhea. Hydrolyzed diet works. If it's improves, then you try and transition it onto a more normal diet. And using, if the animal won't eat the hydrolyzed diet, or during the transition, we'll use what we call a single novel protein. So it may just be lamb and rice, or fish and potato, something like that. And again, you can control the signs really in a lot of cases of intestinal inflammation just with diet. Interestingly, if you take biopsies, the inflammation may still be there, and you may just have given it a diet that's more easily digestible. But if it's not got signs, that's a win to a certain extent. Yeah. But we don't know what the hydrolyzed diet's doing. Is it you're just reducing inflammation? Are you altering the microbiome? And I think probably you're altering the microbiome is the most likely. And then there is a diet that Hills make, and I'm not paid by Hills. They've never funded any of my research, called Gi Biome, which
that's one of the newer ones on the market.
One of the newer ones. I don't know how much it costs. I expect it's expensive, but they did a lot of research into microbiome and have included ingredients in that diet that kind of encourage the beneficial bacteria that you would particularly find in probiotics. So it's a more natural way of developing those healthy microbiome. So it's certainly one to try.
Yeah, definitely. Yeah, it's one of those ones that it does seem to work in the patients that I've used it in, but then who knows if I'd have tried that patient in just the bog standard ID.
Mm-hmm.
You don't know, do you?
No, you don't. No. Yeah. But I mean, my attitude is, if you can, start with a hydrolyzed diet, because that's the most likely to work. And then if it is working after about 6 weeks and things have resolved, then trying to transition. I mean, I've got one case. I think the dog's still alive. It was a 60 kilo Akita that's been on Hills ZD since about 2011. And it's still on it. It does really well, but the guy must be a millionaire or bankrupt.
I know, it's like 65 pounds a bag. I always cringe when I price it up. Yeah.
I mean, the hydrolysis process is expensive.
Yeah, absolutely.
Yeah. And I'm sure that there's a profit in it for the pet food companies, but they spent a lot of money developing them, so it's fair enough.
Yeah, no, it's fascinating. And it was really interesting your point on fibre, actually, because that's been a huge sort of trendy subject, hasn't it?
Yeah,
your food.
Sorry. I mean, fiber, the gut needs some fiber, particularly the large intestine, the colon, because the fiber gets fermented and produces nutrients for the cells lining the colon. But too much fiber, it may just be because it's abrasive. I'm not recommending a fiber-free diet because that will give the animal diarrhea, but high fiber diets may not be great if the animal's on non-steroidals. But again, that more of evidence for that in people than there is in dogs, but there are some studies from Japan that suggest fiber, the amount of fiber has an effect. And then there are different fibers. Some are more abrasive, they're insoluble and would cause more damage.
Is there a specific one that when you've done your research or with your patients that is one that you find most effective when you've got a dog with?
Metamucil when it's available, and certainly it is in the States. So psyllium is the extract from the plantain plant.
That's the one that we see the food companies adding, don't we? Because that's in all the ingredients. Yeah.
I mean, if you've got a good quality commercial diet, it'll probably have the right amount of fiber. It won't be excessive. It's if people are using a lot of fiber because the animal's got diarrhea, then that potentially could make gastric ulceration worse. So, I mean, I said at the beginning, non-steroidals are contraindicated in GI disease. However, I think you have to weigh up the risk versus the benefit. And if the animal can't walk because it's not having its non-steroidals and it gets a bit of diarrhea with the non-steroidals, then that may be acceptable. I mean, it's a risk, but the benefit in that situation is better. But under the licensing regulations, these are contraindicated. So it's an off-label use.
Yeah, it's really tricky, isn't it? Because it's such a balance all the time, and most of our patients have, especially when they get older, multiple health conditions all at the same time, and it's it's a really fine balance.
I mean, it's a bit like you're not supposed to use meloxicam when the animal has heart disease. That's what the data sheet says, but actually, it's because the drug company, when they developed it, never tested it in animals with heart disease. So they just put it on the data sheet because they didn't want to be sued, which is fair enough. But my understanding from cardiologists is it's completely safe in heart disease. It might not be in coronary artery disease because non-steroidals affect platelet function, but dogs don't get coronary artery disease like people do. So there's no reason you can't use non-steroidals if an animal has a heart problem. And I know occasionally you get people trying to sue their vet because they read the data sheet and my dog's got a heart problem and they gave it meloxicam. Yeah, it's fine. It's just it's an off-label use.
Yeah. Exciting. No, good. Well, thank you so much for sort of giving us your time and trying to answer sort of all of everyone's questions. And just giving us a real insight into sort of GI disease alongside arthritis, because it's been I've certainly found it really useful, and I know that everyone else has sort of said how useful it is, and thank you. And there's so many people who have said hello from all over the world. So
okay, there's one other question I was going to answer.
Oh, is there one that I've missed? Sorry.
It's about using bovine colostrum.
Oh yes, yeah.
And there are some commercial dog foods that actually have antibody plasma proteins spray dried onto them, so that it's like colostrum, and you actually use more frequently in pig food, where it does seem to have some benefit, but I don't know where you get a source of bovine colostrum commercially. I suppose it is available. You could try it. I mean, I don't think it's going to do any harm. Whether it's beneficial is debatable.
Yes, there's so much on the market now these days, isn't there?
Yeah, so Barbara was saying the gut closest to the absorption of the antibodies from colostrum after 48 hours after birth, and yeah, that's true in dogs. But when you're adding it to food, what you're doing is coating the lining of the gut with the antibody. You're not trying to absorb it and sort of work in the bloodstream. It's just working locally on the surface of the gut to try and bind bacteria that might be trying to get in across the gut wall.
Okay, so it could still be useful.
Maybe it may alter the microbiome. We come back to the trendy thing.
Yeah, it's going to be really interesting. Sorry, that for dogs. That's my yappy shelties.
Oh dear. Okay.
But it's been so lovely to chat with you and see you again, Ed. And yeah, we just want to say thank you from the whole CAM team for donating your time to us and for making sure that you answer everyone's questions. And if you're up for it, we would love to have you back. But of course, you need to enjoy your retirement as well.
Yeah, I think by the time you get me back, I'm going to be so out of date, it probably wouldn't be good. But still, I will send Amy the PowerPoint as a PDF that they can put up on the website if people want the slides. Okay, and thank you everybody who's tuned in for this on a Friday. I mean, it's the weekend. Go and enjoy yourself. And thanks very much.
Yeah, hope you have a lovely weekend and see you, CAM followers. Bye-bye.
Bye.